We are back with Dr. Andrew Wallace with the Cone Health Regional Center for Infectious Disease, and he's answering the most common questions about monkeypox. All right, so we've talked about the spread, we've talked about clothing and trying that on. What are the symptoms of monkeypox?
They can vary, but the typical symptoms are going to be fever, a headache, muscle aches, swollen lymph nodes, chills, being really tired, and then importantly, a rash that can look like pimples or even blisters.
All right, so those first few symptoms that you said, they sound like a lot of other similar conditions like the flu or COVID or any of that kind of stuff. So how would you know the difference? Does the rash come on right at the beginning, or what should we be looking for?
No, the rash comes on a little bit later, but with monkeypox and chickenpox, they're both viral infections that can cause similar appearing rashes, but for now, really, they tend to appear in different demographic groups. Monkeypox has largely shown up in men who have sex with men, and chickenpox has typically been more common in kids. But adults can get chickenpox if they're not vaccinated, and we have seen a couple of cases of monkeypox in children. That being said, I think understanding your risk based on possible exposure is important. And the safest thing to do is to get tested if you are concerned. There's a test for chickenpox, there's a test for monkeypox. Similarly, we have obviously tests for the flu and for COVID, which would not have the rash that we've been seeing with monkeypox.
And you can do that at your doctor's office, you can do that at the health department.
Mm-hmm.
Okay. All right. So what should you do if you are concerned that you may have it or may have been exposed? I'm guessing that testing is the first thing that you do. And then what?
I think if you're concerned that you have monkeypox or you've been exposed, is to contact your healthcare provider, the local health department, to find out about testing and possible access to vaccination. You should also avoid sex or being intimate with anyone until you've been checked out by a healthcare provider. And currently the recommendations are to give vaccine priority to those most at risk, which, as I mentioned, includes the community of men who have sex with men and household contacts or close contacts of somebody who has monkeypox.
Is there a quarantine involved with monkeypox?
There is, yes.
Okay. And so what steps should people take to prevent getting it? I mean, you just think to yourself, I think there are people who are watching who are like, okay, I don't want to sit next to anybody. I don't want to, be in close contact with people in a crowd. So what should they do to prevent it?
You should ideally avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Avoid contact with objects and materials that a person with monkeypox has used, and wash your hands often. While the overall risk to the community is low, if you are part of a population that is at risk, then getting vaccinated would be recommended, and consider possibly temporarily changing some of the behaviors that increase your risk of being exposed.
When we're talking about testing, I know we kind of just briefly touched on it, like if you are feeling like you may have had, access to it or something of that nature, you could go to your health department or the doctor. Is it a blood test? Is it a spit test? What kind of test are we talking about?
It would be a PCR test where they would swab a lesion, a rash lesion.
Gotcha. Okay. So at that point, once you have the flu symptoms like the fever and the chills and that kind of stuff, and then if you develop a rash, that is when they would test. But they wouldn't test you before that time for that?
Right. The testing would be a swab of one of the rash areas.
Okay. All right. So when we're talking about this, I mean, I know that there's probably lots of other questions. What do you think the biggest misconception about monkeypox is that you want to make sure that people leave, this afternoon with?
Kind of like with one of the previous questions, like I mentioned, the overall risk to the community is low. We're mostly seeing monkeypox in men who have sex with men in close contacts of those who have been diagnosed with monkeypox. However, it's not considered a sexually transmitted disease, but instead it's just often spread through close, sustained physical contact. which obviously can include sexual contact. So with our current outbreak, while that's been the most likely way to contract it, it's certainly not the only way that you can get monkeypox.
And I know there may be some people who say, you know, I never went to the doctor for COVID and it eventually went away. Can that be the same for monkeypox as well?
Yeah, it's typically a self-limited resolving process.
But I mean, we're talking weeks or we're talking months?
It could be several weeks.
Several weeks, okay, if you did not go to the doctor for any of that. Okay, we appreciate you taking your time out to answer our questions, kind of giving us a better lay of the land of what's going on when it comes to monkeypox. If you missed any of today's To Your Wellbeing, you can find it all online. It's going to be under the To Your Wellbeing section on WFMYnews2.com.